Please welcome our two guest experts, Dr. Marjorie Dixon and Bryce Wylde.
Thank you.
We brought you here together to talk about natural ways to increase infertility. So we have spent a bit of time talking about infertility on the show. It's a topic that is so wildly popular with so many of our viewers. And, you know, a lot of people going through issues and trying to figure out what they need to do to fix it. So let's start by talking about infertility. What is it? What you might be able to do to boost it.
Right.
Marjorie.
Okay, so some of the definitions of infertility need to be clarified. So one is, if you're less than 35 years of age, it's 1 year of unprotected intercourse without conceiving. If you're over 35 years of age, 6 months. Because we had talked, remember we had talked about AMH and the quality of the eggs, and as you get older, your eggs get less and less good, and therefore you should wait longer when you're older. Less long when you're older. So after age 35, 6 months, you get a consult. Before 35, you can wait a whole year-ish.
Got it.
Yeah.
All right.
But the point of having this conversation today, I think it's important to define all the issues around fertility, but also to say that there are some adjuvant therapies that we can do that are validated. And there's a lot of skepticism around. So traditionally, what we look at for infertility is the eggs, the uterus and the tubes, if they function, and the sperm. Kind of the three components. 2 things in the woman, 1 thing in the male. And then we see if there are problems with them. One of the very common things that we see with infertility is problems with ovulation, ovulatory dysfunction. So if the eggs never get a chance to contact the sperm, then people can't get pregnant. So if there's a problem with the tubes, if there's a problem with the way that the brain and the ovaries communicate to get the eggs out, if the ovaries are failing for whatever reason and can't get the eggs out, or the eggs in them are poor quality or bad quality overall, then people won't get pregnant. So there's also something called primary versus secondary infertility. So primary infertility is someone who's never had a child before, who then can't conceive. And then secondary infertility is someone who's been able to conceive at another point in their life. So even if they have had a miscarriage, that counts as a previous pregnancy. So that's secondary to something has happened that has changed the game, and then they have secondary infertility.
Okay, so a lot of different variables. But don't panic unless you've tried and you've had the unprotected intercourse for the amount of time that's stipulated. And then at that point, you can go and seek other advice, right?
Right, but I think that it's also important to know that there are certain things, and we were just talking about this before. You can do things on your own ahead of time, and Bryce was saying that you should act like you're pregnant or going to be pregnant for most of your life, and then you'll be healthy, or eat healthfully and think about lifestyle management your whole life as if you're pregnant, and then you make your body an optimal place to grow a person.
So what do you need to do? What do you need to do? What are natural things you can do to boost your fertility?
Your fertility. So you look at your life, there's certain lifestyle variables that you need to do. One of the things is, think about your fertility, age. So when you're young and you're traveling and you're doing all these, and there's nothing wrong with that, and I'm not saying that there's anything wrong with doing those things, but I think that people need to be cognizant that there is a time limitation. And the younger you are when you try, the better. I'm not saying have babies when you're 16.
I was just going to say, if you were 16 and you were watching this show, you do this, la 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 la. Not for you.
Not for you. But later on, ideally, physiologically, babies in our 20s to early 30s. It's the way it's supposed to be. That being said, we do have measures of helping people who are having trouble. So there are the ovulation induction age, the medications, and there's room for that. But yeah, so age is one of the things. Try to have babies young if you're in a place where you can. Then you won't need people like me or help from him.
Okay, let's talk about help from Bryce. You've brought a few things that might be able to help your fertility, and they are all natural.
That's right,
And
I think it's important to underscore May, because May is really the the under theme. And let me just first say, I mean, luminary, best educated, first class in her kind, Dr. Dixon. If she's considering this stuff, it's worthy of consideration, let me say. So this is the nice thing, is that we're starting to bridge this between conventional and alternative medicine. In fact, it's no longer alternative, it's integrative. And that's what I want to underscore, coming full circle, is this is the things you can include in conjunction, or concomitant, as we refer to it as in clinical world, concomitant to what you might already be doing with your expert.
Okay, so
and there's good proof in the pudding.
You can put these natural remedies in.
So things like N-acetylcysteine or inositol hexaphosphate, these two guys right here, IP6 or inositol hexaphosphate and N-acetylcysteine, which is kind of like an amino acid, are antioxidants. So the couple of things they'll do for you is they will improve the quality of your egg as a female. They will also increase insulin sensitivity. And that is really important, because insulin sensitivity, one of the major issues behind infertility, sub-infertility, in females, is polycystic ovarian syndrome, PCOS. And we have to treat those and act as if the individual's diabetic, because they experience very similar symptoms to diabetic, problems with regulation in blood sugar. So if you're going to take some supplements to improve blood sugar status, and by the way, that includes alpha-lipoic acid as well. That's my trifectas: N-acetylcysteine, IP6, and alpha-lipoic acid. These three
you don't have to be
clinical
able to say
studies,
any of that stuff to take it.
Say IP6.
But we were talking, behind the scenes here, and the clinical data is just it's incredible. So I mean, in one of the Bibles, fertility and sterility, the Bibles for good docs like Dr. Dixon.
For reproductive endocrinology. It's where most of the basic science research, the mainstay of it is published, that human reproduction, but that's really what we get. The American Society for Reproductive Medicine puts this out once a month with all of the visionaries, the luminaries. I don't know that I am so much, but the people that do the research. And top quality research, randomized controlled studies, looking at these things used in conjunction with what we do for ovulation induction.
So for example,
okay, I need to bring the conversation from here to here for a second.
So with these
all
supplements,
of those big words you're using, what you're saying is incorporate these natural remedies
100%.
into your regime.
Into your regime.
But here's my question. Let's say you are going to use those two bottles you just pointed to, because I'm not trying to say those names. Are you using them just for the period within which you want to be reproductive, or are you using them from age 25 because you feel like these are your childbearing years and you may or may not be having a baby within the next 20 years or 10 years?
If I may, I'll start by saying, until you're diagnosed and you're under the supervision of a clinician who understands, what the diagnosis of either subfertility or, frankly, infertility is, then there may not be a reason for this. But coming back to the studies that are done, if you are diagnosed subfertile and you are concomitantly, or that is in conjunction, you're taking, let's say, IVF, and we know that acronym is in vitro fertilization, these will improve your chances of getting pregnant by up to 20%. So goes the studies. For example, so these are antioxidants, natural vitamin mineral concept to take in conjunction, and by increasing these at the time, to answer your question, when you otherwise are deemed...
use it at the time when you
use it at
want
the time,
to be reproducing.
You can.
You can.
So I think that it's important for us, like, you can use it in preparation to optimize your fertility, but there may be a time where you talk to your physician, you've been on a blog and everybody wants to do all of these things. Talk to your doctor, and if they are not amenable to it, say, I know that there are studies out there that may show that it's of benefit to me in my traditional fertility therapy. And it's not all hocus pocus, and I think that that's what physicians worry about. And then patients as well, they want to do whatever is within their power, and people are vulnerable and looking. This stuff is validated.
And it can't harm you, right?
Well, you know what? Let's talk about that, because there are some on the table here.
We only have 10 seconds.
Okay, DHEA, it's a hormone, and you know what? You can't take this kind of stuff without consulting a physician who's going to track your actual DHEA levels. So it's marketed as something that could actually help infertility, but don't do anything until you consult with a doctor.
Unless you're monitored.
Okay, chat with your doc. Thanks for the information, guys. Let's go to break. More coming up. Stay with us.